Also, we are really happy to be again part of the Global Goals Week, though this time virtually, and the Global Week for the Act for SDGs, both initiatives to drive the SDGs forward. With the Impact Hub, we work on the transition to a new economy, an economy that is fit for the 21st century in line with the SDGs. And in particular, one that is sustainable, regenerative, and also circular, and as opposed to the take, make, waste model in which we operate now. We are a global network located in over 100 cities across the world, across 5 continents, making it one of the largest communities and accelerators for the SDGs in the world. And if you haven't visited an Impact Hub already, we invite you to do so. To drive the shift towards the SDGs, we run a number of different initiatives and programs. And the largest program in our network is Accelerate 2030, which is a program co-initiated with the UNDP back in 2016. It has grown since it was initiated. It has grown in more than 30 countries, attracting over 1,600 entrepreneurs and numerous partners across the globe. What do we do? So we scout for the most promising entrepreneurs with solutions on the SDGs across the global south. And then we deliver support and connect them with strategic partners, both locally and globally, and especially focused on making key introductions in the ecosystem in Geneva, here in Switzerland, with an aim to support the entrepreneurs to scale their impact. Yes, thank you. We have so this is an example of our international cohort of entrepreneurs. And as you can see, they're very diverse in geography, covering different sectors ranging from water and sanitation, agri-tech, and health innovation. And you have the great pleasure today to hear of some of the global entrepreneurs here in the call. We're also really proud to say that our entrepreneurs, especially here now in the year of crisis, have really had an amazing impact and have succeeded in pivoting and adapting to the crisis to address and come up with amazing solutions and pivoted their solutions towards the COVID crisis. And within the last year, we also see the entrepreneurs have achieved more than a 200% increase in their end users and been able to raise funds and continue to raise employment in their communities. We invite you to visit our impact report for more information. We'll put it in the chat here, but it's really, really inspiring what these entrepreneurs from the Global South can do. In our program, we are particularly focused on the theme of circular or the environment and circular economy and integrate this into the methodology of entrepreneurs that are tackling SDGs across the board. However, in certain countries, we do have a special focus on circular economy. And here we've seen some really amazing solutions ranging from solutions in new materials, agri-tech solutions, waste management, clean energy, and more. And I think this is really, really the way forward on how we can see that some of these solutions can be adapted or are already already focusing on sectors such as the health sector to really drive and, as we call it, turn it around the current situation that we're all in. So for us, this is really, there is a major need for us to work together to scale these solutions, to support the entrepreneurs that are coming from the global south, emerging in developing countries, and see and explore how we can support the entrepreneurs to bring these their amazing solutions to scale. And that's also part of one of our themes in our event here today as well, is like, how do we collaborate to turn it around for a sustainable world going forward? So looking very much forward to the event coming ahead, and very proud of the whole group of people that are here today. Thank you very much.
Thank you so much, Santu. And it's really my pleasure to introduce our first speaker, Matthew, today. Dr. Matthew Meyer, he's a parent of 2 young children who are his motivation for his work in healthcare sustainability. Matthew is a sustainable healthcare researcher, a steering committee member of Virginia Clinicians for Climate Action, and co-chair of the University of Virginia Health Sustainability Committee. Matthew co-founded Periop Green to develop technology to reduce operating room waste to the least amount possible, and works clinically as an anesthesiologist and is an assistant professor at the University of Virginia. Matthew, it's great to have you with us today. Could you kick us off with some big picture framing and personal anecdotes? Could you provide an overview of the health sector's impact and then move more concretely to your motivation and what that implies for your day-to-day work as ICU doctor and sustainability advocate?
Sure. Thank you very much for that kind introduction, Markus. And thank you just for the opportunity to be here with such an incredible panel and on such a very important topic. I want to start just before I know healthcare is not a monolith. And I'm going to talk about the healthcare systems that I'm familiar with. And I don't mean to exclude anything. If there's any input people want to feed back to me, I'm always open. I'm definitely going to be interested, and I very well may improve my own practice. My point here today is to really connect health and the environment. And what I want to talk about is the impact that healthcare specifically has upon the environment. So healthcare itself contributes 4.4% of global emissions. If the healthcare sector was a country, it would be number 5 on the list, behind Russia and in front of Japan in terms of emissions. It also makes tens of millions, if not hundreds of millions of tons of garbage. The emissions and pollution contaminate the most essential parts of human life: the air we breathe, the water we drink, the land where we get our food. Environmental health and human health are inextricably linked, and the healthcare sector should and needs to lead the sustainable economy. So this past August, the Intergovernmental Panel on Climate Change, as we're all familiar with, had a landmark report approved by 195 different countries that humans are causing climate change and that we have about 10 years or less to actually start to mitigate the worst impacts of it. It's time for us to accelerate our work. So I'm an anesthesiologist. I work in the operating room. I am in an environment that generates a lot of garbage and that uses a lot of energy. It didn't take too long for me to realize that my sustainable ethic and my career choice were at odds with one another. And so that was the point at which I decided it was time for me to become an advocate for sustainable health and to understand how I myself can help push us to be better and what I can learn from the people that are already doing this and out ahead of me. So in my efforts, I want to share a couple of sort of the gems that I've discovered and also get feedback from you all. I've noticed a couple of challenges. First and foremost is the financial challenge when you're addressing sustainability in healthcare. Many administrators look at it and think about the green premium. They think this is going to cost me more, when in fact they should think we're going to be efficient and we're going to actually save costs. There's also the issue with single-use devices and disposable items. This is convenient for hospitals in some regard, probably more expensive in the long run, but it's also very good for companies, because if you sell something once, you make a profit once. If you sell something over and over and over again, you make that profit over and over again. So the incentives are for companies to include disposables or make their item transition from being reusable to disposable. So that's a financial issue. Healthcare system also generates incredibly complex waste. Papers, plastics, different types of plastics, metals. And there's always this concern that it might be contaminated with something infectious or with human fluids that prevents people from really wanting to use post-healthcare items in other consumables. And then I think something that's even more pertinent now, but has been pertinent for a while, is crisis fatigue. Even before COVID, the healthcare system was stressed. It was dealing with major existential crises like accessibility, equality, resource limitation. And now COVID has essentially shown has really shown the weaknesses of the healthcare system. And climate, even though it seems to be so important, and we're starting to make note of that, it just hasn't risen to that level of addressing at this point. But that doesn't mean that there isn't any value to sustainable healthcare to health systems. So first and foremost, there's a very strong alignment between mission of healthcare, which is caring for humans, and the mission of sustainability, which is caring for resources. Reducing pollution improves population health. So patients also appreciate when institutions share their values. You're likely going to get more patients, and this is particularly important in the US with our health system. You're going to get more patients if they look at your health system and see their values. It's also going to help you hold on to employees. Employees like companies, and this is doctors, nurses, administrators, other clinicians, They like to work for places that share their values, and retention is very expensive for health systems. And then the other big issue is that major opportunities in health systems for sustainability will lead to cost reductions. And it will also lead to an improvement in population health, which is very meaningful for nationalized health systems. So what's happening? Healthcare clinicians and health systems are starting to create the foundation for sustainable health, and we need to jump on it. So advocacy. The Lancet in 2009 said climate change was the largest global health issue, bar none. This was 12 years ago. Just this month, in an unprecedented editorial published in over 200 medical journals, this was essentially reiterated and said it's time for emergency action on the climate, and we need to change health to lead us there. We're also seeing pledges for net zero emissions. In the US, Kaiser Permanente is a large health system which claims that it's reached net zero, and it's fantastic that it's doing that and leading. The NHS in the UK, it has a goal of net zero across the entire country by 2040. And so here's what we need from the entrepreneurs, from the people, from everyone that's outside of healthcare. And if you're inside it as well, it comes back to the R's. So reduce. Healthcare is too valuable of a resource to waste. We need data and we need analytics to minimize or eliminate waste in the healthcare system. We need to reuse high quality reusable items designed for durability, sterilization, and tracking. Recycle. Whatever can't be reusable needs to be designed to be recyclable. We need to rethink alternatives to plastics, simplify materials and processes, and disseminate best practices. And then we remake single-use items designed for either the circular economy or to biodegrade. So healthcare is essential for all of our lives and our global economy. When we make healthcare sustainable, we move the entire world towards sustainability. Sustainable health and climate changes are solvable with current technology and resources. It is simply a matter of will. The people who contribute to these solutions will have a place in history, and they'll probably make a fortune doing it.
Thank you so much, Matthew, for these insights and the overview. I feel like we're really lucky today to be joined by such an amazing group, leading the way to make the health sector more sustainable and provide such inspiration for us all. And moving on to Elena from the WHO, and as just mentioned by Matthew, the WHO declared that climate change is the greatest threat to global health in the 21st century and has done significant work around the topic of climate change and health. Elena Villalobos-Prats is responsible for technical and programming guidance on climate change and health at the World Health Organization headquarters in Geneva. Elena has been working in that climate change and health unit in WHO for the past 12 years, and in her current position at WHO is responsible for capacity building and country support. This includes implementing the components of the WHO work plan on climate change and health related to strengthening health systems' resilience to climate change, including generating technical guidance and supporting countries in developing the health component of national adaptation plans. Elena, I can't see you yet, but it's a pleasure to have you here. If you manage to switch on your video. Here we go.
Okay.
So, Elena, it's a real pleasure to have you with us. Could you share with us your personal journey at the WHO and your insights on the work around climate change and health? And what is the role of WHO in driving the environmental agenda? And how does sustainability and innovation fit into the work around strengthening and creating resilient health systems?
Well, basically, as you all know, probably WHO is the UN technical agency in charge of health. So basically, we have the capacity and the convening power to basically bring together other UN agencies, technical agencies, and of course, policymakers at country level. So basically, we can create policy dialogues, we can support ministries of health and other ministries to develop health promoting policies. We work a lot with other sectors. We have something that is called health in all policies. So basically working with ministries of energy, transport, infrastructure, urban design. Basically, we just try to work with them and support them to understand and maximize all of the health gains that can be obtained from interventions in the sectors. We have 4 key functions. One is setting norms and standards. So basically, we're working with countries. We are quite good basically at developing technical guidance and setting which are the criteria that should accompany any environmental health intervention. In the department where I work, which is basically the Environment, Climate and Health Department, we are dealing with everything that we call environment. It's basically everything that surrounds us is water, sanitation and hygiene, chemicals, radiation, occupational health, because we consider this also to be an environment, air pollution and energy, urban health, and also, of course, climate change, which is specifically the unit where I'm sitting. So we develop norms and standards for across all these areas. We develop interventions. We recently launched, basically 1 or 2 weeks ago, a compendium on environmental health interventions. We've been working with other UN agencies, and this is a compendium of more than 400 environmental health interventions that should be implemented at country level. So basically, again, we can bring together other partners, leverage their comparative advantage, basically, to get these things done. And we can influence the policy landscape. We also develop the global research agenda on specific environmental health issues. And of course, then we monitor what is the progress made in a specific topic. No? For example, we are the guardians of specific SDGs indicators related to water, sanitation, to energy and air pollution. So this is basically, I think, our role in leading the environmental health agenda. Basically, we are the ones defining which is the interlinkage between the environment and health. And we, when I say we, is WHO, of course, but all the scientists, all the academia, all the experts that basically contribute to the work that we do, and practitioners.
Thank you so much, Elena. That's very insightful. Next, we'll hear from Louise, who joins us from the US. Louise Proud leads the Environment, Health and Safety program for Pfizer, and she's based in Connecticut. Her key responsibilities include the sponsorship of the environmental sustainability at Pfizer, such as climate action and sustainable medicine programs, overseeing the EHS disclosure and stakeholder engagement. She's a member of the Pfizer Quality Operations and EHS leadership team, the Sustainability Steering Team, and Corporate Crisis Management Team. Louise, thank you very much for joining us this morning. And as one of the largest corporate actors in the healthcare sector, Pfizer plays a strong role in developing and advancing innovations to make the sector more sustainable. Could you speak about Pfizer's role and overall approach to environment and health? And can you share some exciting green or circular innovation along Pfizer's value chains? Louise, I think you're still on mute.
I apologize. Can you hear me
Brilliant.
now? Great. Thank you so much. So firstly, thank you, Markus. And I'd like to extend my appreciation to the Accelerate 2030 team for inviting me to join today's discussion. Really excited to be here and to meet with all of you virtually. So, firstly, I would say that Pfizer's approach to environment and health is guided by science. So science increasingly indicates the profound societal and public health impacts that may result from environmental issues, including climate change. These threats, as Matthew noted in his opening comments, are significant, and we believe that the health sector is uniquely positioned to help address the global health challenges resulting from climate change. As a global biopharmaceutical company, Pfizer takes this responsibility in limiting impact very seriously. We have established 3 key environmental priorities, which includes climate mitigation, conservation of resources, and lastly, reduction of waste. So through our sustained efforts spanning over 20 years, we have delivered a 60% reduction in our greenhouse gas emissions since the year 2000. However, we're not resting there. Recognizing the need for continued action, we have established greenhouse gas reduction goals through the year 2030. These have been approved by the Science Based Targets Initiative as ambitious 1.5 degrees centigrade aligned goals, something I'm very proud of. And this includes taking action to become carbon neutral across our internal operations, which requires a range of actions, including driving energy demand reduction, sourcing electricity from renewable sources, and as necessary, using offsets to address any remaining emissions. We're also focused on our indirect emissions. So these are the emissions that relate to the organizations such as goods and materials suppliers that are instrumental to Pfizer fulfilling its business outcomes. So we have absolute reduction targets established for certain categories such as upstream logistics and business travel. And we're complementing these actions by applying our influence to drive the adoption of science-based greenhouse gas reduction goals across our value chain. And to give you a sense, our value chain includes goods and material services providers, and our indirect emissions are more than 4 times the scale of Pfizer's direct emissions. So that's why we are very keen to build partnerships and drive change. And in addition to our greenhouse gas focus goals, Pfizer is committed to leveraging scientific innovation to reduce the environmental impact of our medicines and vaccines throughout the product development life cycle. So this includes the application of green chemistry and biotechnology programs that limit use of natural resources, enable selection of environmentally preferable materials in process design and execution, and driving selective investment in new manufacturing technologies that reduce waste, increase efficiency, and ultimately reduce the time it takes for our products to go from a concept at R&D into the hands of clinicians and patients who need them the most. So when we think about green and circular innovations, we have been on a journey for about 20 years, and these aspects have not been achieved by us working in isolation. It has required the purposeful action of many dedicated colleagues and collaborators across the world. So for example, each of our manufacturing and research and development sites has established a multi-year environmental sustainability master plan that outlines and guides our actions to reduce impact. And it's these long-term plans and empowerment of colleagues that has enabled hundreds of environmental sustainability projects to have been completed across our network. So whilst these projects range in scale and complexity, to give you a few examples, we focus on the design of our new facilities and facility renovation projects to adopt energy and natural resource conservation technologies. We are focused on replacement of equipment at end of life with energy efficient alternates. We continually work to improve our processes, making enhancements to drive out, for example, solvent or reagent use. We continually implement technologies such as real-time monitoring devices and systems that gives us the opportunity to take interventive action when we notice that the demand changes are rising, because that ultimately increases the efficiency of our operations. We are committed to driving waste reduction in multiple ways. So a couple of examples include establishing reuse programs for shipping containers, particularly when we have cold chain products. Secondly, recycling programs for solvents, plastics, and electronics. And then right through to composting programs to manage food waste from the cafeterias at our facilities. And just to highlight that we are indebted to the grassroots teams across our organization and through our collaborations, because they have helped us tackle a range of topics, delivering areas such as packaging innovation, reducing plastics or cardboard waste in our packaging, and adopting and enabling us to adopt digital solutions that have reduced business travel. So I'll end by saying that we continually seek opportunities to share our learnings throughout our value chain. And honestly, while there is no one magic action that alone will deliver a full solution, through the collective action that leverage expertise, resources, and scale, we are hopeful and confident that we will get there together as a health sector. Thank you.
Thank you so much, Louise, for these insights and concrete examples, and for the emphasis on collaboration. That's so crucial, and we'll get back to that in a moment. We turn to a few Accelerate 2030 entrepreneurs now to hear about their innovations and how they're moving the needle to make the health sector more sustainable in the local and regional contexts. First, we hear from Rafael Figueroa. He's a CEO and co-founder of Portal Telemedicina from Brazil. Portal Telemedicina is a health tech company that provides reliable, fast, and low-cost diagnostics, empowering doctors with AI automated workflows, creating interoperability between cities in Brazil and some parts of Africa. With an award-winning platform, Portal is able to connect clinics, hospitals, and patients to some of the best specialists remotely. And they're able to report exams remotely. Since the beginning of the pandemic, Portal has adapted algorithms to detect COVID-19 in radiology exams with 95% accuracy and launched a teleconsultation application that connects doctors to patients. With over 30 million patients in the system, Portal is active in more than 390 cities and doing thousands of daily diagnostics. Rafael, thank you very much for joining us from Brazil. It's been an amazing journey for telemedicina, particularly during the pandemic. While reading the Portal Telemedicina's impact, it really strikes me on how your technology's ability manages to improve both the health outcomes of the patients and the conversion of an entire health system, making it more accessible and environmentally sustainable. Could you share with us today a bit of the context of Brazil and how you see innovative players like Portal Telemedicina manage to turn around our health sector?
Hello, Markus. Hello, everyone. Thank you for the invitation. It's a pleasure to be here with all these amazing brains. So when we started Portal back in 2013, the original goal was to reduce the distance between medical specialists and the patients, especially patients in the underserved areas such as Africa and Brazilian rainforests. I was seeing some data before this panel. I even had to update that. We're now in 600 cities in these 8 years of operation. And something that really caught our attention is that initially the KPIs that we measure, they were either related to operations, so reducing the time to diagnostic, time to treatment started, or with healthcare KPIs like mortality rate. And these were the things that we're measuring. But as we grew in scale and reached all those millions of patients, we started to notice, and Accelerate 2030 program helped us to calculate that with Impact Hub. We started to notice the beneficial side effects of reducing this distance between the patients, because When you reduce the traveling, you're directly reducing pollutants and CO2 emission. When you think that those patients do not need to go in person to clinics and hospitals, you are also saving in office waste in general and energy. A lot of energy goes to cooling these clinics and hospitals where people have to wait for hours in the line to see a doctor, where they could see this doctor from home. So during the pandemic, I think what changed the most is the mindset and the regulation aspects. These are two things that really guide the way that we work. So we had some limitations, for example, in Brazil, up to 2000 and beginning of last year, 2020, doctor to patient telemedicine was not allowed. So different from the United States, where I'm sure Matthew know Doctor on Demand and Teladoc, which are companies that are doing a lot of consultations. In Brazil, only doctor to doctor were allowed. So a general physician could ask a help for a cardiologist, but a patient could not call his cardiologist directly. This was not allowed up to March last year. So what had to happen was not the CTO of a big group or the Minister of Healthcare, it was actually the pandemic that really obligated the laws to change. And this was the first thing that really impacts. In the moment that they allowed that, we released our app in April. So less than 2 months between changing the law and release Android and iOS apps. So the 5,000 doctors that we have in our network can now talk to their patients and our patients. And this was the first thing. Second thing is the change in mindset, because we have, for example, several medical specialists that were actually in the risk group. So imagine you're a cardiology, but you're over 60, and you as a doctor is not recommended to see your patients during the pandemic, but they have their own like clients and people that need prescriptions, controlled medicine, for example. And so not only the patients came to us saying, I need a tool to talk to my doctor remotely, but a lot of doctors, new doctors came to talk to us saying, I have my practice, I have my 2,000 recurrent patients, and I cannot talk to them. So let's use this tool to bridge this gap and connect the two sides. And this is way more a change in mindset for these conservative doctors, that now that they switch to use that, they see that this technology is actually a friend. It's increasing their productivity. It's enabling them to see more patients per hour, to do more diagnostics per hour. And this is something that helps to embrace the tech. Second aspect related to that as well, it's the way they use AI. We use AI to prioritize emergencies. So abnormal electrocardiogram will reach the doctor in 30 seconds, while a normal electrocardiogram can wait 30 minutes. And by prioritizing the queue daily, we can focus on the cases that actually need an intervention. And this brought some data for us. For example, when I look at 1.5 million encounters that we did remotely, 85% of the problem, the patient problems, diseases, and findings were solved online. So 85% of those patients didn't need to travel. And this saved a lot of CO2 and gas and all that. And for the 15% that actually need to do something, we solve 5% more with digital prescription, and only 10% actually had to go somewhere. And after almost 2 years in the pandemic, 18 months working in this new model, what we're seeing now is that the big insurance, the big network of hospitals, they also changed the mindset, and they are pushing telemedicine, saying only come to the hospital if you actually need it, because they see that only 10% actually need to go there. And our last aspect is we found out that for this whole workflow, the nurses are actually the protagonists, because they're the ones that need to be in the last mile, doing the exams, doing the treatment. Most of physicians were able to come working from home, and also some patients. But when the patients actually need an exam, a hemogram, a blood test, anything like that, it's not the doctors they're doing, are the nurses and the technicians. And we noticed that, at least in Brazil, 85% of these professionals are women, and they are usually excluded from the decision cycles in the clinics. So what we noticed that after doing e-learning courses and training these nurses, so they became digital healthcare nurses, now they are doing telecardiology, teleneurology, teleradiology. They amplify the portfolio of exams that they can do, and now they're included in the decision cycle, because the owner of the clinic is asking them, can I do telemedicine? What device should I acquire? Can I use this or that too? And by being included, this decrease the gender inequality between them, because now these women are the protagonists. And at the same time, they increase the portfolio of medical modalities that these small clinics are doing. And by doing that, this small neighborhood clinic now became a true like multimodality hospital almost, but with only nurses. The physicians are working from home, and only this 10% of patients that need something, they go in these small neighborhood clinics, do a series of exams with these nurses, and the neurologists 2,000 miles away do the teleneurology diagnostic, for example. So by doing that, we are not only avoiding the travel because they are doing telemedicine, but when they have to do exams, they are now doing the local neighborhood lab in the village clinic. They're not need to go into a plane and travel to São Paulo because the nurses are now empowered to do these exams locally. So all these impacts were only possible because of the change of the regulation and the mindset that came with the pandemic. So of course, there's several problems and crises that came with that. But at the same time, I see that after the pandemic is over, the healthcare system will be more equal, will be more efficient, because now they are open to this type of tech changing the workflows.
Such a great story. Muito obrigado, Rafael. Now we hear from Faisal, an Accelerate 2030 entrepreneur from Indonesia. Faisal Rizki is the CEO and co-founder of Sampangan. Sampangan converts all kinds of waste into sustainable materials using what they call a magic box carbonization technology. They offer zero waste and environmentally safe waste processing technology to governments, municipalities, business and agriculture plantations. The technology can be deployed on site, creating waste processing hubs or at the final landfill. Faisal, many thanks for joining us. It's quite late in Indonesia, but please share with us how you leverage Sampangan's technology to pivot during COVID-19 and bring your innovation to the health sector in Indonesia. Also, you've also incorporated some circular principles into your business model. Can you tell us a little bit about that?
Sure, Marcus. Thank you so much. A pleasure to be here. Thank you, Accelerate 2030, for the opportunity. So for us, we started off as a waste processing company, but then when the pandemic hits, a lot of our initial government contract for waste processing has been halted. So we needed a way to figure out on how can we pivot our business, but more importantly, how can we also solve the emerging problem that come because of the pandemic. So some of the problems that we see on the ground in Indonesia is that, of course, hospital waste goes up significantly. So we're looking at the number of around 30,000 tons of waste per annum is generated, over 30%, 40% more than previous years before the pandemic. Second one is in Indonesia, we have around 3,000 hospitals. And out of these 3,000 hospitals, less than 10% of them actually have an on-site incinerators to process the medical waste, right? In which they have to rely on third-party service provider to manage their hospital waste. Now, the problem is Indonesia is an archipelagic country with 5 main islands, right? And then the toxic waste service provider are centralized in 2 main islands in Java and in Sumatra. So we're looking at Kalimantan, East Indonesia, they do not have same level of access to these facilities, right? And not only that, another problem is because in archipelagic country, the transportation of this medical waste is also very, very difficult, right? And even so, with the limited incinerators available at the current hospitals, at the processing centers, they are all using incinerators, which actually creates an additional problem. It removes the waste, yes, but it also introduces new problems such as high energy requirement, which contribute to climate change via greenhouse gases, because they're burning fossil fuel, a source of energy. And they're creating dangerous gases such as carbon dioxide, black carbon that is released to the air, polluting the air that is affecting the people in the communities around the area. The solution that we need is something, a process and technology that is scalable, decentralized waste processing sites that can be deployed in equal distribution at all of the geographical areas in Indonesia and not centralized operation. And most importantly, a technology that is energy efficient, and environmentally safe. So we have the alternative to incinerators and open fire pitches, right? And we call this technology the magic box. So why does it call the magic box? Because we can take in all kinds of waste without the need to be pre-processed or sorted, and are able to convert that into sustainable materials. So the technology that we use is thermal based, but it's not burning, it's heat radiation, and where we convert this waste using carbonization process, which is a combination of pyrolysis and gasification, something that may be commonly known as high and intensive energy technology, but we're able to operate at a very low temperature of only 100 to 400 degrees Celsius, way more efficient than the existing technology. And the second one is the technology that we call the hydrolyzed cyclone, where we neutralize and dissolve dangerous, toxic, and chemical gases into liquid smoke that can be used as biodisinfectants to fight the pandemic. Right. So we did a project in a hospital in Aceh, in Sumatra Island, in collaboration with Indonesia Agency for Assessment and Application of Technology, as well as the Environment Ministry. The results and benefits are as follows. Number one, it gets the job done. So we are able to neutralize the syringe, mask, and all of other medical waste. Second one is more affordable because it's on site, cutting waste logistics, significantly lower carbon footprint and lower carbon emission. And we can also neutralize the toxic and dangerous gases through our process and dissolve carbon dioxide. So only steam output that comes out, like fighting climate change head on. And most importantly, to create a product to fight the pandemic, which is a biodisinfectant and biosanitizer that is an alternative to alcohol and chemical-based. The one that we have phenolic and carbonyl compound that dissolve protein and fat that bacteria and virus need to survive. So in the context of putting in circular principles into our operation, we are able to solve a different problem through this pandemic that enables us to grow 10x in revenue the past 1 year. And that is to convert landfill leachate waste to become biodisinfectant. From this operation, we're able to distribute 500,000 liters of biodisinfectant to sanitize public spaces, open areas, and offices, affecting over 100,000 citizens in the city that we operate in. And this is all thanks to the modules and experience and mentors that we got from the Accelerate 2030 program that opens us up to this new thinking methodology and framework. And this allows us to see the opportunity from the problem that we are facing as a company. So yeah, I hope that we can find a way to collaborate and scale and solve this problem globally, to solve the health waste problem, as well as fighting climate change directly using the magic box. Thank you, Markus.
Thank you so much, Fauzola. I really love today's contribution, bringing together such a diverse set of stakeholders that work to make the health sector more sustainable. And you just mentioned it, like Louise did before, collaboration is really crucial. And we have goal 70 that explicitly calls out for collaboration, and collaboration is also the core essence of the Accelerate 2030 program. I would like to ask our panel, what role does cross-sector collaboration more concretely play in your work? And what synergies do you see moving forward? Elena, could we start with you? Would you like to start on how the WHO collaborates on climate change and health? What are some of the challenges and how do you see you could overcome them?
Thanks so much for this very good question. Basically, in the climate change and health team, we have 3 key areas of work. One is related to addressing the impacts of climate change. Another one is working with other sectors to basically maximize health co-benefits of adaptation and intervention and mitigation in the respective sectors. And then the third one, and more related to this discussion, is basically all the work that we do building climate resilient health systems while basically getting them in a path, what we call climate resilient and environmentally sustainable health systems and facilities. So in all the work that we do, mainly in relation to facilities and systems, we work with lots of stakeholders at country level, regional level, and global level. But at country level, we have the opportunity to, for example, build partnerships to look at some of the things that our presenters before were basically explaining. All the work that we do at healthcare facilities, we divide it between 4 different components: water, sanitation, and waste management. Another one is related to infrastructure, technology, and products. So everything related to procurement, and simple things like also related to energy efficiency and reducing, basically finding solutions to minimize the impact on the overall environment. So basically we work with NGOs that in some cases help us to assess the carbon footprint of healthcare facilities, and then we have a set of interventions. And having the knowledge of people like everybody that is present today who have already piloted interventions that are contributing on site, basically taking out all these environmental practices that create a little bit of the problem, basically, and learning from them and involving, we have a real opportunity to do that. Basically, is through research, academia, and also NGOs at country level. But of course, we need to improve the way that we collaborate with the private sector. We don't have a very good record in doing so, and there is a huge potential to involve the private sector and basically make sure that they help us to drive this agenda forward.
Brilliant. Thanks, Elena. Matthew, as a health practitioner, and your efforts on circular economy, reducing waste, reusing, recycling, what do you see is needed for collaboration efforts in the US, and what are the challenges, and how can we turn that around?
It's a big question you're asking me. Almost everything at this point is needed. There's currently, there's been a real strong push from reusables into disposables. That's been, Raphael mentioned the power of regulation, and it's been sort of led by issues with sterility that has moved people to use more disposables. But as we've moved towards all of these disposables, we're creating more garbage, unsurprisingly. And each one of those devices, if it can't be made as the appropriate reusable, which is can be tracked, can be cleaned, can be cared for, and is durable, then it should really be turned into something that can either be biodegrade or enter into the circular economy with an intentional plan for its disposal. There are some inklings out there. You start to get the feeling that some of the larger medical device manufacturers are offering refurbishment policies, or I had someone tell me that their monitor came in a smaller box recently. So we're starting to chip around the edges, but really we need more.
Thanks, Matthew. Time really flies, and we have a lot of interest also from our audience. Let's take a few questions. Maybe one for Louise. There's an increased pressure on the ESG front, particularly for large corporates, listed companies, from investors, but also increasingly from consumers. How do we accelerate this transition towards a more sustainable and circular health sector? And how can we keep at the same time the transparency on individual efforts so that free riders, greenwashing does not get out of your hand? Maybe more concretely, how do you ensure a transparent trajectory of Pfizer towards the 2030 climate goals?
Okay, so thanks very much for that question. So it's a great one, and truly at Pfizer we believe that to strengthen our sector contributions, transparency to our actions and progress is really critically important. So one example is that we report out our progress against our annual goals within our annual report. So I'd encourage you, if you're interested, our most recent 2020 Environmental, Social and Governance report is currently published on Pfizer.com, and that outlines our areas of focus, our performance, and describes our renewed commitments. But in addition to self-reporting, we welcome the review and feedback on our performance from external reporting organizations, and we participate in voluntary disclosure programs. So for example, for the past, in fact, for over 10 years, we have participated in CDP, formerly known as the Carbon Disclosure Project, which is an annual disclosure process. We submit reports related to climate change and water security. That gives us a company-wide rating. You can find those ratings on the CDP website. And Pfizer was also featured within their Stories of Change reports in 2018 and 2020. So again, a couple of case studies on specific actions that we've taken. And then more recently, beginning in 2019, investors, as you described, Markus, are increasingly interested in the risks and opportunities associated with climate change and how those are being addressed as part of the company-wide strategy. So what we have done is to align our reporting with the Task Force for Climate-Related Financial Disclosures, or TCFD framework. So that describes, what we see as the long-term challenges, areas such as, in increasing, transition to a net zero environment, taxation programs, those types of things, as well as the opportunities related to tackling these continued public health challenges that at the heart are born in climate change. So those are just a few examples that I hope are helpful in terms of what we do, and we certainly would encourage to drive for use of these disclosure frameworks. We certainly welcome kind of increased alignment on common reporting frameworks that allows us to outline our actions compared to others. So thank you.
Thank you very much, Louise. And indeed, this is very encouraging that companies step forward on the science-based targets, working with CDC, particularly on the newest pathways that we are on, that are rather towards a 2.7 degrees increase, which is quite shocking. Time is flying, but I want to ask another question to Raphael or Faisal on actually seizing the moment with the COVID pandemic. And you mentioned that the pandemic basically accelerated some of our work, but what do you think are some of the challenges that you currently face to really, turn the status quo and the current diagnostic or service delivery system that we have around in order to create more scale, or for instance, in the case of Portal Telemedicina, what can you do to really scale it further beyond Brazil and make a difference and collaborate potentially with other partners?
Great question, Markus. I think the next step now is to start to publish results, because since this it's all new, although we do have all these millions of patients that now create historical data, we now need to start to publish that. And this is something that we are talking with UNAIDS, UNDP, and several organizations to measure these impacts in the cities that we're working with and release scientific publications, white papers, and really a guideline to show like the ROI that it's possible to create in those cities based in this new method of thinking. Some like quick data to share here. We did an analysis to prepare to this panel. I couldn't look at the 30 million patients because we have a lot of customers that buy the platform to take care of the patients with their own doctors. For example, United Health Group, they bought our platform and they take care with their own doctors. So this data cannot share, but I can share the 1.5 million encounters that we did ourselves with our own doctors and what type of KPIs it's brought. So when we think about the CO2 emissions that I mentioned, so saving time traveling, when I look at this 1.5 million, they are distributed in around 600 cities, and the traveling kilometers that they save by doing these online encounters is around 40 million kilometers not traveled by doing these encounters online, which then link to millions of liters of gas and a monetary saving of around 3 billion, I'm talking dollars here, only in traveling saved. And when you think about time saved, that people were not in transit or waiting at the waiting room in the hostel, we're talking around 1 million hours saved for these patients that do not need to travel or be in waiting room. And when we convert this directly to CO2, it's roughly 17,000 metric tons of CO2 emissions avoided, which translated to 20,000 acres of forest saved. And I'm talking only these visits. If you extrapolate to the 30 million patients that we have, you can imagine how much CO2 is being saved. Some other interesting points, it's, as I mentioned, all the energy that is being saved. We couldn't calculate this exactly, but imagine that air conditioners were not used for these thousands of almost 1 million hours that people are not in the clinic. So this is also a fact. We also save, as a collateral benefit, a lot of office waste, paperwork, and for example, in radiology, there's a lot of chemicals involved for printing this stuff that now is just being sending online through PAC systems for radiology. And all these chemicals are also being saved. And when you combine all this, you have a very strong sustainability index related to every telemedicine encounter that will avoid all these other things that I mentioned. And when you think about healthcare KPIs and costs, so one city that I mentioned that I will mention that we measured the whole thing. So we work 24 months with this city. 100% of the population is covered through this telemedicine program. So it's a public healthcare program where in the first 12 months, so 2019 to 20, we were able to reduce 25% the mortality rate for non-communicable diseases. And when you get 20 to 21, we now arrive at 45% reduction in mortality rate by this non-communicable diseases like cardiovascular diseases. And the cost actually saved 30% of the cost. So it was not an extra cost to buy the tech, it was the opposite. After measuring this for 12 months, they saved 30% while reducing the mortality rate by 45% and saving all the CO2 emission pollutants. So it was quite obvious to us after we did this study how impactful this is for environmental aspects as well, and not only for healthcare. And the next steps now is transforming these in actual articles and publishing, so this can become also an inspiration and a framework. And something that we are doing now, when a clinic wants to turn digital, we have a pack that we send ready. So e-learning to learn and then integrate with the devices that they already have. And I think this is the main, the key thing that make this adoption fast, is the fact that we integrate with the devices that already exist. So there's not a cost of change. You can use my tech, but you need to buy a new X-ray device. Then it will not work. So we had a lot of work in interoperability to integrate with legacy devices in the way that we also saving that. Do not need to replace the old stuff. It's working well. So train the staff that we already have, integrate with the device that we already have, and then you have all these KPIs. So without having to change heavily the system, only changing protocols and the way that people are communicating, you can have all these strong benefits.
Thanks so much, Rafael, and apologies, Faisal. We are at time, but before we close today, I would like to give Elena 1 minute to share her vision for an environmentally sustainable health sector in the future. Elena, do you want to share a call for action to those in the audience and other stakeholders in the health sector to bring this vision to life?
I think that this is very timely because for the first time, there will be an official health program as part of the COP. So together with the UK as the president of the COP26, we have developed a full health program, which includes an initiative on climate resilient health systems and another one on low carbon sustainable health systems. A third very relevant initiative is basically the one related to getting the health voice across, just to raise the ambition. So I invite all of you basically to join these initiatives. You can find them online. I will share the link here, because basically, as we all have been saying as part of the health sector, we have the opportunity to convert this into an opportunity to start the change that is required to tackle the problem of climate change. So basically, I think that together we can get to this, and we can lead by example. So I will just share the link and count on you.
Thank you so much, Elena, and thank you all to all speakers for the inspiration and the valuable contribution, not only today during the call, but thank you for your daily work. With big thanks to you all, I would like to hand it over to Santu to have some final words of closing, and thank you very much for the last hour.
Oops, mute. Thank you very much, everyone. I think probably many of you have been quite inspired to listen to our Accelerate entrepreneurs here that have some amazing solutions, and how you guys have been able to pivot in this time and be very creative. I was very inspired by the story of you have the legal change, and within 2 months you actually come to market with a new solution. This is an invitation for all of you to join in. We have hundreds of entrepreneurs across the global south that have an amazing solution on the SDGs, and we are looking for experts. Do you have skills? Do you have networks, strategic networks, investors and others that can support and helping the entrepreneurs to scale? So feel free at any point of time to get in touch, because the message here today has been very clear. It's really through collaboration, through opening up our networks, so through seeing how we can work together, that we can turn things around. And also from my part, a big thank you to all of you here. A big thank you to Pfizer, WHO, our partners, and especially the amazing entrepreneurs that are on the ground and that are really making a difference. So I was very happy to have you all here today. So with that said, please be in touch, and wishing you all a good afternoon or a morning or wherever you are, in whatever time zone you are today, but we'll be in touch. Thank you all.
Thank you.